Thank you for watching our important video series that we call Ask the Doctor. We'll be sharing several videos with you of questions that you have submitted. We will ask those to UofL Health doctors about the COVID-19 vaccine. Thank you for submitting your questions and your responses to us. We had more than 200 questions, and we've pulled out common themes to ask the doctors from UofL Health about the COVID-19 vaccine. And the first doctor we're going to be talking to today is Dr. Jason Smith, who is the Chief Medical Officer and a trauma surgeon at UofL Health. Thank you for being here with us today.
Pleasure to be here. Thanks for having me.
I know you've answered a lot of these questions many times before, so we appreciate you answering them again for us so we can share that with our employees. And I'm going to jump right in. So one of the questions that we got several times was, should we be concerned about the pace in which this vaccine was developed? It seemed to move very quickly.
It did move very quickly. And to be honest with you, I think this is going to be the pace that we see the delivery of vaccines probably in the future. The best part about this vaccine is they were able to deliver this vaccine very quickly, but they did so very safely. They followed all of the protocols that were required to keep it safe. They did all of the studies to look at how safe it would be in people to get this vaccine and how effective it is against the virus.
One of the questions that we got several questions actually about family planning and pregnancy. So one of the questions is, should someone who's pregnant take the vaccine?
What we know is that, first of all, I'll be honest, they did not look at this vaccine in pregnant patients. However, there were a number of patients that actually were in the study that got pregnant during the study, and they've been able to follow them. There were never any signs that the vaccine caused any difficulties with either fertility or pregnancy during any of these stages that they did, the phase 1, phase 2, or phase 3 trials. Getting a vaccine during pregnancy is not a new thing, and I anticipate that this is going to be just as safe as all the other ones that we have done in the past.
Should mothers who are nursing take the vaccine?
Yeah, we do not think that this vaccine will cause problems with breastfeeding or nursing.
So can someone get the vaccine if they have already had COVID-19?
You can. What we usually have told people is if you've had COVID-19 within the last 90 days, you may want to wait to get the vaccine. The reason for that is you probably have an immune response to COVID already. It will not cause you any harm. And in fact, it will only boost your chance to have immunity if you get the vaccine if you've had COVID before. So it won't hurt you. It may actually help you.
Do we know how long the vaccine is effective? How long does it last in your system?
We don't. We're currently undergoing studies to identify how long it will last. Some of the first people that got the vaccine in that first study that was done have still been able to have an immune response to that vaccine. And some of those first patients are almost 8 months out now. And so we know it lasts at least that long.
Do we have a good idea of who should not get the vaccine?
Right now, the biggest thing that we're looking at across the vaccine is we've had a number of patients that have had some anaphylaxis. So if you do have an anaphylactic reaction, meaning you get swelling of your mouth, you get swelling of your throat or difficulty breathing after a vaccine, or if you require an EpiPen for some other allergy that you have, that's a group of patients that we need to have special conversations with.
So Dr. Smith, thank you so much for joining us. We appreciate your time and your insight. Your knowledge has been great for our staff and for our employees. This is the first in a series of videos. Coming up in our next video, we'll be talking to Dr. Valerie Briones-Pryor, asking her more of your questions about the COVID-19 vaccine. I'm Renee Murphy. Thank you for watching.